Welcome to Basic Disaster Behavioral Health Just-in-Time Training for MRC volunteers. This training has been developed by the Virginia Department of Behavioral Health and Developmental Services and is intended for volunteers responding to a public health emergency. This course is designed to better equip MRC volunteers to assist citizens with mental or behavioral health issues resulting from a public health emergency. Another goal of the course is to provide resources for MRC volunteers to connect citizens with more in-depth behavioral health supports in their local community. First, let's examine the many psychological impacts of disasters. It is important to remember the impacts of disasters on an individual's behavioral or mental health vary wildly. Some people exhibit very few symptoms of behavioral or psychological issues, while for others the symptoms can be significant. The various types of psychological impact are contextualized by an individual's culture, their age, their baseline health status, their baseline mental health status, and more. These can impact all facets of their life, including emotionally, psychosocially, physical well-being, and cognitive ability. Another important consideration regarding the psychological impacts of disasters is that disasters affect almost everybody who experiences them. But for most people, the impacts of those disasters will resolve over time and on their own. No matter why a citizen reached out, you may notice behaviors or things they say that may indicate the citizen could use behavioral health support. You may see uncontrollable crying or even crying at inappropriate moments. You might notice an inability to focus on the conversation at hand or the inability to provide direct answers to questions you ask. You may notice they are acting irrationally or exhibiting a high level of anger or aggression for no reason, or they may simply request mental or behavioral health assistance. In addition to behaviors that we just mentioned, the citizen may tell you about common stress reactions that they are experiencing. This may include difficulty sleeping, trouble concentrating or performing normal tasks, increase in irritability or quick to anger, as well as being fearful of something they know may happen or the unknown. They may indicate they are experiencing feelings of withdrawal or isolation exacerbated by the stay-at-home order and social distancing practices. Due to the bad news, they may feel hopeless, leading to the onset or worsening of anxiety and depression. These feelings could lead to thoughts or ideation of self-harm or frequent substance use or abuse to cope with the situation. There are several ways you can assist citizens with the psychological challenges they may be facing. Review these 8 core actions. As much as you want to help the citizens you come in contact with, you must be aware of your limitations. Disaster behavioral health is about helping people learn to adapt to their new environment and their new reality. It is not any type of therapy, including trauma therapy or grief counseling or any other type of mental or behavioral health assistance. You cannot provide any type of evaluation or diagnosis of any condition, mental health or otherwise. It is not your role to conduct any psychological debriefing or critical incident debriefing or trauma debriefing. The first and most effective way you can assist a citizen to work through their psychological issues is through contact and engagement. This can be very powerful to help people feel better about their current predicament. Often, just listening is an important part of disaster behavioral health services, and listening without judgment and helping to normalize a citizen's feelings can go a long way in assisting them. You can use helpful and supportive statements such as, "What you're feeling is a normal reaction, and it's okay to feel that way," or, "I can tell that's difficult for you," or finally, "Thank you for sharing that challenge with me." However, you should avoid saying, "Everything is going to be fine," or, "I know how you feel." Reflective listening lets people know you're hearing them, that you are connected to them, and that you understand what they are saying. The first step in reflective listening is to listen carefully and seek to understand what the individual is saying. When you think you understand what the person is saying, then you can offer that idea back to the individual to let them know you heard and understand what they have said. You're just paraphrasing what they told you and reflecting their position back to them. Often, people just need to be heard. You can explore this skill further with material provided in the toolkit. Another way to assist citizens is through information gathering. As you are trying to listen for what the individual is saying he or she needs, Keep in mind that oftentimes psychological impacts of disaster can limit an individual's ability to think clearly and even follow normal directions. If you have to give a person a list of instructions for what to do next, encourage them to write the information down to be referenced later. Another way to aid the citizen is to help them complete forms to obtain further assistance from various agencies or to inform them of the information they will need to complete those forms. Another significant way you can assist individuals with disaster behavioral health ideas is to provide information on various coping strategies. No one expects you to be experts on coping, but you can offer the following tips: encouraging them to maintain routines and keep up their self-care. Encourage them to exercise in any form. Share ideas about maintaining social connectedness during self-isolation, such as social media and video calls. Encourage people to take a break from the news for several hours or even a few days can be very helpful. Another way you can assist individuals is to connect them with needed social supports. However, during this current crisis, some of the normal social supports such as faith-based organizations or support groups are not available or may be occurring virtually. Also, governmental social supports should still be operational in some capacity. Offices that provide essential services may be using telehealth or other virtual means, but should be operational in the individual's community. If this connection helps resolve their stress, that's a win. Finally, you need to be able to connect an individual who is asking for or demonstrating a need for more in-depth behavioral health assistance with those services in their community. It is critical you have at your fingertips the resources to connect the individual with the local community services board and the local behavioral health supports. The toolkit that accompanies this training provides access to the 40 local community services boards across the Commonwealth. Also, included in the toolkit is a list of national resources that may not exist in the person's local community, including the National Suicide Hotline and a Disaster Distress Helpline. There are also links to additional resources to enhance your training, such as psychological first aid. Finally, there are some video links on reflective listening as well as conversation do's and don'ts.